My name is Morgan Sikes, and I would like to share a little more information with you about my article, Pediatric Multiple Sclerosis, Current Perspectives on Health Behaviors. Pediatric-onset multiple sclerosis, or POMS, affects approximately 10,000 children in the United States. Children diagnosed with POMS experience higher relapse rates than adults with MS, along with physical and mental fatigue, cognitive impairment, and depression. My colleagues and I believe health behaviors, like physical activity, diet, and sleep, could have potential benefits for children with POMS. We completed a scoping review to identify existing literature that may support or challenge this notion. But what are health behaviors? Health behaviors are directly observable actions that broadly influence health status. Health status can be thought of as physical, mental, and social well-being. Health behaviors can be separated into two distinct categories: health-promoting and health-compromising behaviors. Health-promoting behaviors benefit or improve health, while health-compromising behaviors weaken health in either the short or long term. Health-promoting behaviors typically involve physical activity, including exercise, healthy diet, including weight control, and sleep hygiene, including consistent bedtime routines. We undertook a scoping review of health behaviors in POMS, as it provided an overview of current evidence and identified future directions for health behavior research in this population. We limited our focus on the health behaviors of diet, physical activity, and sleep, as these three health behaviors are the most commonly studied in POMS, and further represent appropriate targets for future health-promoting behavioral interventions. Obesity is included in diet, as obesity is frequently an outcome of health-compromising behaviors such as overeating. This scoping review is a necessary first step in establishing a research agenda for health behavior participation, in developing health promotion programs, and in creating population-specific interventions targeting health behavior engagement for children with POMS. We found 20 papers that addressed health-promoting behavior in POMS. 11 of the papers focused on diet. Higher levels of vitamin D were associated with fewer relapses, and this association was mediated by a known genetic risk factor called HLA. Dietary iron was lower in POMS than in controls, and iron consumption below recommended levels was associated with a POMS diagnosis. Higher body mass index, or obesity, was a risk factor for developing POMS and was associated with a younger onset of POMS symptoms. More than 50% of children with POMS were overweight or obese at the time of diagnosis. 8 papers focused on physical activity. Children with POMS engaged in lower levels of physical activity than healthy controls and children with other demyelinating diseases. Higher exercise goal setting and self-efficacy were correlated with higher levels of physical activity, and higher perceived limitations were correlated with lower levels of physical activity. Higher levels of participation in strenuous physical activity were associated with smaller T2 lesion volumes, less fatigue, and lower relapse rates. 3 papers focused on sleep. Children with POMS were able to manage sleep hygiene better than healthy peers, as evidenced by more consistent bedtime schedules as measured by the Sleep Stability Subscale of the Adolescent Sleep Hygiene Scale. Higher levels of physical activity were associated with fewer sleep, rest, fatigue symptoms. From the information gathered in this review, we are excitedly looking forward to more research in this area. From here, we believe descriptive research related to healthy behaviors is warranted. Validation of methods to measure health behavior engagement and reliability of these measures is very important. Future research involving qualitative and cross-sectional methodologies to investigate predictors of health behavior engagement and consequences of these behaviors would also be very useful. If we, as researchers, systematically address these opportunities, clinicians will have a greatly expanded body of research supporting the promotion of health behavior change for adolescents diagnosed with POMS. Thank you for your interest in our study. If you have any questions, please contact us at uab.edu/ENRL.